Hey, you did everything right. You lost the weight, you feel healthier, but then you look in the mirror and your face looks older. And that doesn't make sense. Here's the problem. Weight loss doesn't just shrink your body, it deflates your face. Your face is built on layers of fat that sit under the skin like cushions. They hold everything up to give you shape. They reflect light in a way that makes you look healthy. But when you lose weight, especially quickly, these deeper fat layers shrink and the skin doesn't keep up. So instead of tightening, it falls inward. Cheeks flatten, temples sink, the lines deepen, the jawline starts to blur. Here's the part most people miss. This is not aging, it's volume loss. That's not age, that's deflation. And it can happen fast, especially with significant weight loss, like bariatric surgery or medications like Ozempic. But here's where this changes. Most people try to fix this the wrong way. They think tighter skin is the answer. It may be because your prior support has significantly decreased. With that loss of support, your face starts to sag. So there are two things going on. First, your skin and mass has descended. But underneath, loss of volume from decreased fat means you've lost structure underneath as well. So in order to look better and more youthful, you have to look at both the overlying skin as well as volume underneath. And everyone responds differently to the weight loss, depending on your age and ultimately your genetics. For some, it's a small volume loss. In these cases, targeted filler injections can help. If you have more significant volume loss and your skin is elastic, then larger volumes of filler or even fat transfer can help. In fat transfer, we use your own fat, carefully placed to restore natural contours. However, if your face is also sagging and you get the effect you want by lifting your face, but your skin is also getting loose, then just getting more and more fillers may not be the answer either. In fact, you might actually look overfilled and unnatural. Your skin is already too loose to lift from the filler. In these cases, more filler just becomes more weight that goes down, and you look unnatural. In these cases, you also need a physical lift. There are some non-surgical options to lift the face. Threading is very popular in the world, but I'm not a fan of threading at all. Threading uses dissolvable barbed sutures tunneled almost quote-unquote blindly under your skin, hoping to engage sagging tissue and pull up. The failure rate is high, and results don't last long, maybe a year at most. My practice might be biased, because almost every patient I see that I mention this say that A, they either don't like that, or B, tried it and said it was a terrible experience. So in my practice, if someone needs a physical lift, I almost always recommend some sort of facelift. Here's what matters most. The plan has to match your face, not a trend, not a quick fix. Because if you just chase fullness, you end up looking puffy. If you ignore volume, you stay looking tired. Balance is everything. That's important, but this is what really matters. You did something incredible by losing the weight. But I like to tell people that losing weight is a double-edged sword. On the one hand, after you lost the weight, you are healthier. But unfortunately, you look older. Volume gives youthfulness. Think of a baby, nice and chubby and youthful. Picture a marathon runner, super healthy, but very skinny and often look much older. Your face should reflect your health and also look youthful. So if you're looking in the mirror and thinking, why do I look older when I feel healthier? You're not imagining it, and you're not stuck with it either. You just need the right strategy. If you're trying to figure this out on your own, that's where people make decisions they regret. Too much filler, the wrong procedure, or waiting too long to fix something that only gets harder over time. If you want a plan that actually fits your face and your goals, I'm here to help. Because you didn't put in all that work to feel better, just to lose your confidence when you look in the mirror.